Hello,
Hello.
Bhumi, you're in the dark.
Yeah.
Hi, Sunita. Hi, Tracy.
Hello, Doc.
I'm glad you're able to join this. I was supposed to text you, I forgot.
Oh, thank you so much.
Yes. But not a big deal because we're not actually teaching anything today. I'm going to show you certain things. But yeah, let us wait for a few more folks to join. I believe we have around 7 or 8 who are in this call. So we'll give a couple of minutes for them, probably until 7 or 3, and then we can get started.
Okay.
Just by the way, sir, this is Eric.
Yes, I got your from your last name. Yes.
Yeah, the name that is there is a little confusing, but it's still me.
That's perfect. Yes. So I'm going to quickly be back. Okay, nice. Okay, guys, I guess we'll get started. I'm going to see if there's anyone that is supposed to join today. Okay, let's get started. So what I wanted to do in the next 15 or 20 minutes is to just to give you an overview of what we're going to do in the next three months or 12 weeks. I mean, you can play around with the numbers and kind of do the course faster or slow. You can pick your pace, but normally we tend to do it between 8 to 12 weeks. So our classes will run for 12 weeks. So every Tuesdays and every Thursday, we'll start at 7 p.m. Probably will go until 8. And if there are more questions or something needs to be covered, we go for 8:30. So normally we end between 1 hour to 1.5 hours. So you can schedule your other activities, regarding Tuesdays and Thursdays in that way. We don't change the schedule once it is on Tuesdays and Thursdays. It will be on the same day. probably an hour, this way, that way, but normally between 7 and 9. So either the classes start at 7 or the classes are at 8 o'clock. So not more than that. And the other thing is I just wanted to also show you the LMS modules that we have, how you can access it, all those little things. And some of you don't need this, but some might have some questions. So I just wanted to take you through how do you access it. Most of you, I think all of you, have already given were given access to LMS modules. So I just want to show you how you can kind of access them. Let me share my screen. I don't know how to do this. Are you able to see my screen now?
Yes.
So all you do is you get into certificateprograms.medipharmsolutions.com and you go into student login. And once you go into login, you use your username and password, which was given to you. I believe it should have been emailed to you by now. So once you log in, this is an admin account, so you'll see other courses as well. But once you log in, you should be able to see certificate program in advanced drug safety and pharmacovigilance. That's the only thing that you'll see, and you click on it and it will go into the program itself. You will see all the modules that are there. Just click on one of the module, like start with this.
Hello, sir. Hello, sir. My screen is blank. I don't know whether the rest are seeing anything.
Are you able to see my screen, guys?
It was blank, white.
Now, can you see it?
No. Not yet. Not yet.
Okay. How about now?
Yes, we can see. I can see.
Eric, are you able to see, Doc?
Yes, I can see now. Thank you.
Okay, so now once you go into this program, you're going to see all the modules on your left-hand side. So the video that, let us say if you missed this 7 o'clock class today, you can look at the same video under this, how to do this program effectively. You will see the previous versions, but I think it is of no use to you because I pretty much repeat the same thing to every batch. So you will see it as September 2021 here, and all these things might be deleted by tomorrow. So that's how it will work for you, and you can go back and listen to this video if you need. So the points I wanted to do, the points I wanted to reflect on in this very short session is the objective of this course is to give you the right and enough information to get into pharmacovigilance in terms of job placement. So that's the only objective of this course. So you will find, you don't need to do any other textbooks, any other material. You don't need to do a thesis work outside of this course, because I've seen people students do all that, and they end up being more confused than where they got started. So if you stick to this, curriculum we have and the videos that you can see already in the modules, along with your live webinars, that is more than enough for job placement, for getting an overall, very good picture of pharmacovigilance. You have everything that you need to, kind of get a career started in pharmacovigilance. And of course, you can always learn as you go along. It's not like you're being taught some 80% of it. You will know everything that you need, and you can always add some practical exposure to what you do on your job. So I would recommend to understand the objective is to make sure that you are having enough information to go through the job interviews and get placed as soon as you can. So that's one. And the second, and the only thing that I would recommend you to do, because I don't want to even say two things to do. I want to say only thing that you need to do for the next 12 weeks or 8 weeks, whatever you choose your timeline to complete this program is this. I really recommend you to attend this live webinars as much as you can. Like, I know there are some time zone difference, there are some, difficulties sometimes, understandable, family situations, great. But having said that, even though it's recorded and you can watch this module the next day, the same content is being recorded, you can go through it, you will make sense out of it. But live webinar is a live webinar. All the questions that are asked, all the answers we give, all the discussions that happen with students, that really sometimes will not make it to a recorded video. Most of the times I want them to do as is. But still, because of the length of the video, sometimes we might have classes for 1.5 hours to 2 hours, and they might not be able to put everything in a video, so they might edit some of them. So again, the point is to attend the live webinars as much as you can. And if you miss 1 or 2 webinars, that's okay. Just try to go into the recordings and do it. Now, the best way to do that is you get an email every Tuesday and every Thursday before 2 p.m. Eastern time for that day's class. The email that you get from Akila will have the topic. So let us say next Tuesday, which is your first class, will have a topic, adverse drug reactions, 7 p.m. by me. So if you see the topic is adverse drug reactions, you don't need to go into the module and listen to the recording before. And that's total waste of time, because you will not understand much from a video, because it might be different from what is going to be presenting to you. So the best way to do this is just to learn just know the topic and follow the live webinar. Take notes if you can, whatever your learning style is. Take notes, and in the class we normally speak about the interview questions. We speak about practical applications of ADRs, and when we do all those things, make notes as you go along. And if needed, visit the module, the same module the next day. And if you want to review the video or review the lecture, you can do that at your own pace. You can stop, pause, and doing all those things. So basically, that's how you do a module. Now, before I get into any details, I just want to make sure I take this time to focus your attention on most important things. The objective is to get information, get all the knowledge that you need for job placement. And the only thing that I want you to do for the next 8 to 12 weeks is to attend this live webinars as much as you can. And the last thing is the modules. The modules, how to access them, you know it right now. But the modules from ADRs, which is adverse drug reactions, I want you to write this thing down. Adverse drug reactions 2, all the way to the next page, to structure of drug safety department. So these are the core modules. So if you really have to go through the modules at your own pace and you want to do the course little faster, I would recommend you to go through these modules first. ADRs to structure of drug safety department. These are core modules, and you should not go into Argus. You should not go into frequently asked questions, interviews, discussion boards, literature search, and whatever else we have in these modules. This will not make sense to you if you don't understand the core subject. So we will add modules as we go along. You might see by the time you are in your, probably the second, third month, you might see more modules, but all those modules will be towards the end of the modules. All the new modules will be towards the end of it. We don't ever change the core modules. So again, people ask me towards the end of the course, what module should I focus more on for the interview process? And that is why we placed it here strategically from ADRs, workflow, triage, seriousness assessment, expectedness assessment, causality assessment, drug dictionary, narrative writing, query generation, reporting timelines, E2B transmission, SUSAR case management, analysis of similar events, SAE reconciliation, medication errors, structure of drug safety department. So probably around 15, 16 modules. So if you can go through them and you understand them, and you don't have to be super fast because fast is not equal to success. Most people do that only to go to an interview. Again, they come back saying, oh, I need to revise this again. So I would rather ask you to do the live webinars because we do it in a sequence. We do it in a way that you will understand it. Now, the last thing I wanted to reflect on, and then you guys can ask me any questions that you have, is it will take time for some of you or most of you to understand pharmacovigilance. It's like learning a new language. You'll not, some folks will get it faster, some folks will get it, at a later date. But initially, don't try to understand everything in the class. If you understand the interview based questions, and when I do the lectures or when Deepthi does the lectures, we all speak the same language because we all have the same talking points. So it's just a different person, but the information given to you and the way it is given to you is the same. So try to understand the interview aspects of it and conceptualize what is being taught to you. If you understand 30-40% of a module in the initial, probably 1-2 weeks, you're good. Because as you keep learning module to module, the pieces of the puzzle will fall into place. So my request is, don't try to force your synapses to understand it right away. It's not going to work that way. It's not rocket science, but still it's something new subject to learn. So we use a lot of abbreviations. Sometimes we use safety language because we talk that language 9 to 5. So sometimes we use those things. So don't let those little things bog you down. Just give some time for those things to settle down. And once you go through the modules, you will understand this as you go along. So that's all I had to just share with you. And of course, you'll have Argus access. We'll start Argus classes by the starting of October. You'll have Argus access by then. We just upgraded to a new version, 8.3.2. We were using 8.3.1. We are now in 8.832. So you'll have access to it. You'll have login and password, like how you have a login password to the accesses, the LMS. So you can start doing cases and everything once we complete the Argus classes. So you don't have to do any Argus case processing until all the case processing is done, which is the end of October. So it's literally like the first month is the core topics, the second month is the Argus, and the third month is all the other modules that are based on job descriptions currently in the market. So you can kind of roughly make it a point to categorize that way. So it helps you in your preparation well. Now, there are some modules which are self-learning, and you will understand which are self-learning, like the first 6 are self-learning, I guess. And there are some modules towards the end of it, like frequently asked questions, success stories, discussion boards. These are all tons of material out there that we collected. And based on your enrollment date, sometimes you only see certain modules. So as you keep going into your 3rd week, 4th week, 6th week, we will release more modules based on your enrollment date, and you will see a lot more modules as you go along. So you have to understand how the course works from the modules perspective. So any questions? I don't have anything more than this, but you guys have any questions at this point that I can answer?
No, I don't have any question.
Awesome.
Hello.
Yes.
Yes, Dr. Abhishek. Thank you so much. I want to know, I went through few of the models and realized not all of them had pre-recorded videos. So are the slides enough? And secondly, I also want to know if after studying each model and I should mark the model as complete, does it follow up with an assessment, or does the assessment come as in at the end of the course?
It comes at the end of the course. Like, that's a good question. So first thing is, not all modules will have pre-recorded videos, because we want to record them as we speak, as we do them batches. So based on your, like as I said, based on your enrollment date, you may not see some of the videos. But as soon as a video is uploaded, video is there, you will be notified. The email will already come from the system saying that so-and-so module was uploaded into this course. You can take a look at it or something like that. So you will get an automatic email from the system saying that some module content has been updated or some module video has been uploaded. So as you keep going to the course, all the assignments, you are going to do three kinds of assignments. One is you're going to do a MEDRA assignment. You don't see it here because it's based on your enrollment date again. So you have to do three assessments, actually four assessments. One is MEDRA coding assessment. That will open up once you are done with your MEDRA coding class. That's number one. Number two, you're going to do narrative writing assessment. And again, these four assessments are based on job interviews. So it's not to test your knowledge per se. It is to test your preparation towards interviews. So here you're going to see all four of them in the order that I'm showing. I'm talking to you. So the first one is MEDRA coding. The next one is narrative writing assessment. The third one is case reporting assessment. Like, what cases do you report? When do you report? By when do you report? All those things. So they're all practically there. You have to do those assessments. And the last is a final assessment where you have 50 questions. They are questions as if someone is asking you in the interview. So you have to go through those 50 questions. And once you complete all those things, we will get an email, like either me, Lavanya, or Deepthi, or Smita, whoever is the person in charge of this group of folks. You'll have an assigned mentor or assigned person. They will get an automatic email saying that your so-and-so assigned person has done this, and then we grade it. And once all four assignments are done, then we mark you as complete. You don't have to mark as complete. If you want to do it, do it. But once you do all the four assessments and once it's reviewed, then we mark it as complete, the whole course, and you can automatically print a certificate with all the credentials. So those things we can, you will see it as you keep going. So once you finish MEDRA module, you can do MEDRA assessment. Once you finish narrative writing, you can do narrative writing. And once all modules are done, you can do your narrative writing, your case reporting assignment and your final assessment. And then you're done with the course. So the point is not to print a certificate, because I think the real certificate is your paycheck. I always keep saying this. So don't be in a rush of just printing a certificate. It's useless. So I think that's what I want to share. Is that answering your question, Tracy?
Yes, Doc. Thank you.
Who is this person on a black screen? I don't see his name or her name. All right, we have Dr. Shama. She's a medical doctor who recently completed her course, and she got placed last week through our marketing. So she's going to come on the same call. If you want to grab your coffee, tea, whatever you need, we're going to hang out for another 15 minutes. So we'll take a break for 5 minutes. We'll come back and she'll be on the line. And you're going to see other batches today. It's not just your batch of 12. You're going to see other batches from June, July, August also joining at 7:30. So it will be very crowded at 7:30. So if you want to take a few minutes break, and we can reconnect on 7:30. Okay.
Okay. Thank you.